Hi viewers, today we are in conversation with Dr. Chanchal Pal. She is an ENT specialist and she has been working in this field from past 30 years. Also, she has been head of the department in Mulchan Hospital. First, I would like to ask, what is the general difference between a general physician and an ENT specialist?
Okay, ENT are ear, nose and throat specialists. So we specifically after doing our MBBS, which a general physician does, we have done a specialization, and in that specialization in the disease of the ear, nose and throat.
What are the symptoms commonly associated with ears, nose and throat?
Most of the children, they come with the common cold, running nose, nose block, ear pain, and sometimes high fever with throat infection. These are commonest causes.
Is there any connection between ears, nose and throat?
Yes, very important question, because most of the time when the child has ear pain, I advise them to put nose drops, and the parents always ask me why so. Because there is one ventilation tube behind which runs behind the nose, goes up to the ear, and it's very important when child has a cold, the ears get affected because of that tube getting blocked. And of course, nose always ends in the throat.
So we can say that there is a connection between
definite
ears,
connection
nose,
between this system.
Okay.
And there's no direct connection between eye and the nose, which
Eyes
is
and nose,
its neighbor though, but there is no direct connection.
What is the best way to clean wax from baby's ears?
See, for that I like to mention this, because this is a question most commonly people ask me. And the thing is that the God has been great, and there's a inbuilt mechanism in our ear to get the ear cleaned. So there's no need to clean the ear. Don't use at least bud to clean the ear or any pin. If you feel that something is popping, if you see with the torch or something, talk to your doctor, pediatrician or ENT specialist, and put some drops so to make the load thinner. And ear has a typical mechanism of migrating its skin outside. So this automatically thrown out, and when you see it in the well of the ear, then you gently can clean, but don't put anything inside the ear.
We can see that even small children are wearing hearing aids nowadays. So what according to you is the probable reason for this?
See, if you see very small child wearing hearing aid, then we are looking at a congenital hearing loss, and that is usually because of pregnancy related problems or genetic problems. Per se, that small children don't need hearing aid as we need for the spectacles for children. It's not related to their lifestyle. But if I talk about teenage, yes, we are seeing patients with the hearing loss due to noise.
How can a parent identify that a child is suffering from tonsils?
Okay, if in very small child, the tonsils, once the small child will cry, will not be able to take food properly, they will have high fever. Unlike adults, children have very high fever with tonsils, and they will refuse feed. And in this, older children, definitely they'll complain of throat pain. But younger children, you should look for some signs, and sometimes you get swelling around the ear. Around the throat.
Okay, so we can say swelling is a symptom and high fever is another symptom for
because
this.
If it is too much, it is not the tonsil, it is glands related to tonsil which cause swelling in the neck.
Okay. What measures can be taken to relieve sinus pain in a kid?
See, for sinus pain, why sinus pain occurs is because of the blocked sinus. A draining sinus won't cause pain. Okay. So we are looking at a blocked sinus. So naturally something to open the sinus will help. So decongestant nasal drop or saline nasal drops and some decongestant can help the child.
Kids are more prone to cold and cough, and while sleeping they are not able to breathe properly. So what according to you can be the best measure that can be taken in this case?
See, most of the time, as I told you, that like your nose also has a system to propel its secretion to the back of our throat. There is ciliary reaction taking place constantly. But when you have cold or when you have sinus infection, what happens that action doesn't take place. So what we have to assist the nose for that. So put nasal drops, saline nasal drop to very small children. Bigger children, you can have decongestant nasal drops and some decongestant if advised by your pediatrician or ENT. In that, word of caution is always there, like drops like decongestant drops which are now marketed in the market, and you can see ads on FM also. They should not be given on regular basis. They are habit forming until unless your physician advises us.
How can a parent differentiate between a sinus infection and cold?
Common cold is a viral infection. Whatever you do, it will last 7 days. Usually, you will have fever, you will have a running nose, blocked nose. But when it turns into sinus infection, you will have that thick yellowish discharge. So, if the quality of the type of the discharge child has, you can differentiate between the two.